Medicosis perfectionalis, let's talk about basilar skull fracture. So, basilar skull fracture is a rare type of fracture that occurs at the base of the skull, typically involving the temporal bone, occipital bone, sphenoid bone, and ethmoid bone. So, what will happen here that the trauma or severe trauma to the skull will lead to tearing in the meninges that surround the brain, and this will lead to leakage of the CSF, the cerebrospinal fluid. So, we will have certain signs and symptoms related to this fracture that we will discuss now. So, first, there is CSF fluid leakage from the ear. This is called otorrhea. I know that the CSF is a clear fluid, but I drew it green just for the sake of illustration. So this is called otorrhea. Also, there is CSF leakage from the nose. This is called rhinorrhea. Okay, so 1 and 2 are CSF leakage. 3 and 4 are ecchymosis, bruises due to the trauma or the fracture. There is ecchymosis around the eye. This is also known as raccoon eyes. They are kind of dark purple to black color. And also there is ecchymosis behind the ear due to damage in the mastoid process, and this is called Battle's sign. Okay. What else? 5 and 6 involve nerve problem. 5, this is an optic nerve problem. Sometimes the optic nerve gets stuck or entrapped in the floor of the orbit. Also 6, there is some cranial nerve palsies. Okay. Then 7 and 8 are blood coming out of the nose and blood coming out of the ear, or maybe it's staying inside the ear and it's called hemotympanum, blood in the middle ear, hemotympanum. Okay, how does the blood and CSF come through the ear? Because there is rupture of the eardrum or the tympanic membrane. Okay, what about 9 and 10? 9 and 10, they involve symptoms described by the patient. So 9 is a bitter taste because sometimes this CSF fluid comes leaking into the nasopharynx and it will cause kind of a salty taste. What is 10? 10 is blood coming. No, 10 is a symptom. It's hearing loss by the patient. The patient says, I cannot hear that well. Also, he may complain of vision problem due to optic nerve entrapment. So these are the 10 signs and symptoms of fractured base of the skull or basilar skull fracture, also known as basal skull fracture. You don't have to see all of them. You just need to recognize them when you see them. Okay, how to manage this? If the patient is conscious, you do CT scan of the C-spine to rule out C-spine fracture. But if the patient is an unconscious patient, remember in medicine there is a general rule. Any patient that is coming unconscious due to trauma, you have to do CT scan of the brain, of the head. CT scan of the head is a must. So if he is unconscious, you do CT scan of the head and extend the same CT scan to involve the C-spine to rule out fracture. So CT scan of the head is involving the C-spine or including the C-spine. So conscious, just CT scan of the spine, and unconscious CT scan of the head, including the C-spine. I hope this clarifies the issues. Basilar skull fracture is a board favorite topic because of the unique signs and symptoms involving with it. Study hard, enjoy your time, take it easy. See you next video.